Hello, everybody, and welcome to NUR 300, Week 4, Part 2, Contemporary Nursing, Issues, Trends, and Management. I am your professor, Dr. Marian Johnson. So welcome back. And this Week 4, in this part, we're going to look at labor budget. That's where we will start. So labor budget is a subset of the operational budget. Its purpose is to provide detailed documentation of salaries, wages, and benefits with respect to the operational unit. Factors that affect the personnel budget include salary rates, overtime, benefits, for example, paid time off, health insurance, staff development and training, and employee turnover. The labor budget is virtually always the largest expense item in an operational budget for healthcare organization because salaries for nurses, other professional staff, pharmacists, physical therapists, etc., and support staff, for example, nursing assistants, unit secretaries, transportation staff, compose the greatest percentage of expenses in the budget. The labor budget is also used to provide managers with a productivity metric, which is the amounts of work produced. For example, hours of nursing care per patient day by a specific amount of input or resources. For example, nursing hours worked. The productivity metric is necessary to give managers a measurement of the number of nursing hours worked in comparison with the amount of patient care provided. Low productivity, high nursing hours worked with low patient census is not desirable because it means higher staff salaries combined with lower revenue for patient care services. High productivity, high patient census with low nursing hours means that there are fewer staff to take care of more patients. So the unit may not be able to provide safe, quality patient care. Most healthcare organizations have a recommended productivity measure that allows for a balance between financial efficiency and quality and safety of patient care. To achieve this balance, nurses must be at the table during budget planning to ensure that the patient quality and safety are discussed along with productivity and financial efficiency. One of the primary difficulties encountered in managing the labor budget is accurately predicting future staffing needs. Because budgets are based on a predicted amount of services, for example, patient census, variances between actual staffing levels and budget level occur if the facility experiences an unanticipated increase or decrease in patient services. Another concern related to the budget and labor expense is balancing the patient acuity or degree of patient illness with the nurse to patient ratio. An important aspect of labor budgeting is understanding the 12-month historical trend for labor hours and patient days. As a general rule, organizations expect nurse managers to control the number of hours worked by staff and not the actual salary expense. Wage levels, benefit costs, and other related expenses are typically controlled at the leadership level. The operational aspect of scheduling staff measured in work hours to meet the needs of patient volume measured by patient census is best controlled and budgeted at the unit or department level. Capital budget. The capital budget represents funds allocated for construction projects and major equipment purchases, for example, cardiac monitor, defibrillator, computer software, typically referred to as capital expenditures. The capital budget is developed separately from the operating budget because payments for capital purchases are spread out over multiple years. The main requirement for a purchase or acquisition to be considered as part of the capital budget is that it has a useful life expectancy of more than 1 year and it costs more than a minimum dollar amount established by the organization, typically $500 to $2,000. The term capital simply refers to the funds used to purchase long-term investments, such as major medical equipment, computer systems, and newly constructed buildings. A capital budget item is an expensive purchase that will be used by the organization for many years. Capital budget items are often referred to as capital assets, long-term investments, capital investments, or capital acquisitions. These capital assets are treated differently from the operating budget expense because of the multi-year value. Because capital purchases are often considered investments, they are scrutinized more carefully during the budget process. Planning capital budget requests tests the nurse manager's long-range planning skills. The nurse manager must be able to look 1 year to several years into the future to identify capital budgeting needs and to bring those needs to the attention of senior management. The unit or department need for a capital purchase must be weighed against the financial implications for the organization's entire capital budget. The nurse manager, along with input from his or her staff, has a critical role in helping to plan the capital budget, justify priorities, and ensure that the needs of the facility and patients are met. Staff nurses are vital to a successful capital planning process because their frontline equipment needs must be made known to management for purchase consideration. Developing a budget. Developing a budget is actually a continual process. Organizations are constantly making projections for future budgets, implementing current budgets, and analyzing month-to-month variances in relations to the budget. The current budget usually covers a 12-month period, also known as the organization's fiscal year. The development of the budget for the new fiscal year occurs a few months ahead of the start of the new fiscal year, so that the budget can be developed and approved at levels before it becomes effective. For example, if the organization's fiscal year is from September 1st to August 31st, then budget development for the new fiscal year will begin sometime early summer, or perhaps earlier depending on the size and complexity of the organization. Because of the number of approval layers, large health systems usually begin the budget process much earlier than smaller systems or single facilities. Healthcare organizations usually have a defined procedure in place for budget development. This defined procedure tells managers whether the budget development will use the incremental method, zero-based method, or some other method defined by the organization. Organizations may also define whether they use a top-down, participatory, or alternative approach to budgeting. In the top-down approach, upper management sets budget goals and imposes those goals on the rest of the organization. In the participatory approach, the people responsible for achieving the budget goals are included in the goal setting. The iterative approach is the combination of top-down and the participatory approach, with upper management defining strategic goals and then unit leaders developing their operating budgets to incorporate their individual goals in conjunction with the organization's strategic goals. One key to understanding budget is to know the unit of service on which costs and revenue are based. Patient days is the common unit of service for inpatient facilities. Patients' visits, or visits by category, short, intermediate, long, are the units of service for ambulatory clinics and home health agencies. Budgets are then developed on the basis of units of service predicted for a given period. For example, the nurse manager in a hospital intensive care unit bases his or her budget on the average number of days that patients are expected to be on the unit over the course of 12 months. The director of the home health agency bases his or her budget on the number of home visits that will be made during a 12-month period. The unit of service may vary dependent on the organization, setting, and financial policies. Thus, it is essential that the nurse understands the unit of service in the area in which he or she is employed. Variance analysis. One primary use of a budget is to evaluate the financial progress of the department or unit. Variance analysis is a process by which deviations from budgeted amounts are examined through comparison of actual financial performance results against expected or budgeted performance. Although this process, variances are evaluated on quantitative and qualitative basis. Quantitative analysis focuses on numerical variances to the budget. Cost concepts related to budgeting. When considering the budget, one must have a basic understanding of how much healthcare services cost and how to predict changes in costs. Consider this question. How much does it cost to provide nursing care to one patient for one 12-hour shift? Unfortunately, the answer is not simple because many factors affect how much something costs. Improving the cost and quality of clinical care. Nurses face challenging situations given the nursing shortage, the focus on cost reductions, and improved quality and safety, and the increasing acuity of patients in all settings from hospitals to home health agencies to nursing homes. At the same time, organizational leaders are faced with challenging economic times, declining reimbursements, and increasing costs in all areas. Changes to improve quality and reduce costs must be made. How can nurses collaborate with organizational leaders and financial managers to make a difference? Nurses are at the front lines of healthcare and are key to enhancing the value of healthcare, with value being the combination of quality and cost. The financial well-being of healthcare organizations and the value of healthcare rests largely in the hands of the clinical team, with the budget serving as the financial guideline that enables the clinical team to provide quality patient care and achieve strategic goals. This lesson has reviewed the four major functions of the organization's budget: planning, communicating, and coordinating, monitoring progress, and evaluating performance. Elements of the three basic types of budgets, operational, labor, and capital, have been described along with the two primary approaches to budgeting, incremental and zero-based. The nurse's role in affecting the organization's financial performance by being an advocate for proper patient care planning and follow-up, evidence-based practice, efficient operations, appropriate supply use, and prevention of complications and hospital-acquired conditions is also reviewed. As nurses advance into supervisory and management positions, it is essential that they further develop their skills and knowledge in budgeting through personal study, working with mentors, attending classes, reading books and journals, and joining professional organizations that promote healthcare finance and budget knowledge. Effective communication and conflict resolution. Effective communication is a foundational component of professional nursing practice. The development of effective communication skills can only enhance each nurse's professional image while building strong relationships with both patients and colleagues. Effective communication is a foundational component of nursing practice. The development of effective communication skills can only enhance each nurse's professional image while building strong relationships with both patients and colleagues. Understanding communication processes and principles is required for nurses to interact professionally with patients, families, and significant others, nursing peers, managers, student nurses, physicians, other members of the interdisciplinary team, and the public. Nurses communicate through a variety of media, including the spoken and written word, demonstration, role modeling, and on occasion, public appearances. The exchange of ideas and feelings is hardly limited to verbal communication. Many types of nonverbal communication are often as meaningful as, and in many instances more meaningful than, audible expression. Because communication is such a complex process, there are infinite opportunities for sending or receiving incorrect messages. All too frequently, communication is faulty, resulting in misperceptions and misunderstandings. The communication process. Communication is a process requiring certain components. There must be a sender, a receiver, and a message. Effective communication is a dynamic process. With a response, feedback, the sender becomes the receiver becomes the sender, and the message changes. The method of delivery influences the effectiveness of communication. In addition, communication is affected by many subcomponents, both environmental and in the minds of the communicators. When communication with another person occurs, verbally or non-verbally, a typical pattern develops that includes the actual message being sent, the receiver's belief or interpretation of that message, and the reaction to the message. Think about the communication activities that occur in the healthcare setting. There is often much to communicate in limited time and sometimes during very high stress situations. In addition to the actual message, personal goals or hidden agendas can influence the way a message is delivered and or received. For this reason, it is very important to understand the many elements that influence the communication process. Interpretation. Interpretation of information can be influenced by such factors as context, environment, participating event, preconceived ideas, personal perceptions, style of transmission, and past experiences. Because of the interaction of these factors, the sender's message may mean to the receiver something that was entirely unplanned or unexpected by the sender. Filtration. The most concise delivery of information is subject to some amount of filtration. Think of the process as similar to washing vegetables in a colander. A large amount of water is poured over the produce. Some of the water comes quickly through the colander holes, some water drips through more slowly, and some water hangs on the colander or settles in the solid portions of the colander and never filters through. If people were not able to filter out a portion of the stimuli that bombarded them daily, the clutter would be unmanageable. At the same time, however, it is possible to filter out some part of the intended communication that is essential to understanding the communication. Feedback. Feedback, simply put, is the response from the receiver. However, As with all communication, feedback is a dynamic process. As the receiver interprets and responds to the original message, the sender begins the same process of feedback to the receiver. Because of this circular property, the process frequently is referred to as the feedback loop. As with the original message, feedback is confined to verbal responses alone, is not confined to verbal responses alone. Both communicants consistently assess nonverbal communications as well. Feedback is formed on the basis of all the components of interpretation and filtration. Positive communication techniques. Effective communication involves a positive exchange of ideas between or among individuals. The successful communicator strives to demonstrate openness, availability, and acceptance both verbally and non-verbally. Following are some of the many techniques that help achieve positive communication style. Negative communication techniques. Several negative communication techniques have been alluded to in the previous discussion. Closed communication styles, such as asking yes or no questions and making inquiries, or statements that require other single-word answers, potentially limit the response of the person and may prevent the discovery of pertinent facts. Closed body language can also hinder effective communication. Closed arms, hands on the hips, avoidance of eye contact, turning away from the person, and moving away from the person all impose a sense of distance in the relationship. 3 other techniques that are detrimental to good communication are termed blocking, false assurances, and conflicting messages. What am I drinking tonight? Lavender mint tea from my Follow Your Own Arrow. Maybe in desperate times, this may be extra credit. Just maybe. Listening. Listening certainly is an important element in clear and effective communication as any other component. Many distractors contribute to poor listening habits. Framing an answer while the other person is still talking interferes with receiving the entire message. Environmental disturbances can provide major disruption. A crying baby, a call light buzzing, and multiple concurrent conversations in a busy nurse's station are a few of the interruptions that jumble the simplest of instructions. Pre-existing concerns or worries can block absorption of conversation because of the preoccupation. Attempts to continue to work in progress leads to inattention. Ineffective engagement or peculiar mannerisms on the part of the speaker can be distracting. A person who does not make eye contact, shuffles through papers while talking, or overuses hand movements actually can deter communication. Active listening involves the 3 steps: listening carefully to what was said, processing the information you heard, and making a decision about what you heard. Does it make sense? Do you believe it? How can you respond appropriately? Written and electronic communication. Charles Dickens referred to the brand new telegraph when he admired machinery. Little could imagine the advances of electronic communication over the decades. But his message is as appropriate today as in the late 1800s. Nothing quite replaces face-to-face communication and the accompanying nonverbal cues. However, Written and electronic communications do open valuable new levels of connection and information exchange. Healthcare in the United States is rapidly moving to the computer-based electronic health records, EHR, to effect higher quality patient care, with most hospitals and healthcare organizations using some type of EHR. Unique issues impact the transition to EHR. Perhaps the most positive aspect is an improved communication among healthcare providers within the institution as well as between geographical distance sites, which result in prompt and knowledgeable care for individual patients. On the negative side is concern about maintaining patient confidentiality and privacy, an expectation that must be met with diligent attention to appropriate system management and careful individual protection of information, passwords, and other access sources for the EHR. As communication moves into the cyber environment with the use of EHR, email and attachments, intranets, chat rooms for clinical discussions and meetings, and further into the realm of social media, the style of healthcare recording is changing. Nurses' electronic clinical notes often comprise detailed checklists, which are designed to address a myriad of potential findings and streamline time spent charting. However, most checklist pages include a box for additional comments, explanations, and charting programs include some vehicle for a narrative entry. The following discussion is just as applicable to electronic charting as to pen and paper charting, perhaps even more so. By their very nature, checklists do not allow for the unexpected or aberrant event. As tempting as it may be to confine the nursing record to the checklist, some occurrences simply cannot be adequately described without a narrative entry. Handoff report. A handoff report occurs anytime the primary care of a patient is transferred from one healthcare provider to another. Examples include end of shift, relocation to another facility or unit within the current facility, and transfer to the operating room, radiology, dialysis, and other areas for testing or shorter periods of care. Every time patient care is transferred represents a potential for patient harm related to lack of adequate information about the patient and his or her needs. Information can be insufficient, inadequate, untimely, misinterpreted, or undergo any number of other missteps that result in minor to severe harm to the patient. Once again, the sender-receiver dichotomy, which all associated communication skills is of primary importance, the Joint Commission recognized the inherent danger of inadequate handoff reporting by issuing a Sentinel event alert, identifying the associated risks and frequent underlying causes, as well as suggestions for improvement. Attention to handoff reporting is particularly important because of the high number of handoffs that occur in healthcare and the severity of errors that can result. Perhaps the most important condition of handoff reporting is that it must be real-time, face-to-face. Recording the report or providing it in written or electronic form leaves too many opportunities for misdata and misunderstanding. Give and take between the sender and receiver must occur so that clarification and feedback are possible. Certainly, written reinforcement of a verbal face-to-face report is essential. Reports should also be given in situations free from interruptions. Communication styles. Communication is influenced by a myriad of individual characteristics learned over a lifetime. However, communication specialists generally recognize four basic communication styles: assertive, aggressive, passive, and passive aggressive. Special influences on communication. Development of truly effective communication necessitates understanding various circumstances that influence communication. In addition to the concepts discussed up to this point, characteristics exist that might impede efficacious exchange of information. Issues such as gender differences, generational differences, cultural diversity, and dissimilarities in the professional approach of the various healthcare disciplines all contribute to disparate understandings and interpretations. Social media. Warning, warning.